Hi, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system, take actions, and try and make a better system for all of us. Today we're going to talk about reproductive health. Before we do, let me point out that in the description box down below is a link to the Healthcare Advocacy newsletter. You can, of course, subscribe for free. It is the text for today's video, and all of the studies and news articles and actions that we mentioned, they're all in there. Okay, so let's get started. Abortion is going to become much more readily available in California shortly. California's efforts to expand access to abortion care are enabling more types of medical practitioners to perform certain abortion procedures. This is potentially a boon for patients, especially in rural areas, but a source of concern, of course, for doctors' groups that have long fought efforts to expand the role of non-physicians. I want to point out that in the newsletter, you can read the entire article from the San Francisco Chronicle. The latest move is a law that enables trained physician assistants, known as physician associates, to perform first trimester abortions without a supervising physician present. The measure, which passed last year, took effect this past January 1st. It also lets physician assistants who have been disciplined or convicted solely for performing an abortion in a state where the practice is restricted, they can apply for a license in California. Physician assistants are now on a par with nurse practitioners and certified nurse midwives trained in abortion care who, in 2022, won the ability to perform abortions without a doctor present. The need for more abortion care practitioners is being driven by efforts in many states to gut abortion rights following the Supreme Court's 2022 decision ending constitutional protection for the procedure. 31 states have implemented abortion restrictions that range from cutting federal funding for abortion coverage to outright bans, according to the Guttmacher Institute, which is a research organization concerned with reproductive health. Of course, the American Medical Association is opposed. Let me share a brief story with you. Over 100 years ago, the AMA opposed midwifery. They were above board about it. They said anything having to do with that is a medical procedure, and they wanted the fees. At the time, midwives often also performed abortions, and doctors said, no, we'll do it. You don't know what you're doing, and by the way, we want the money. Charming. After the Supreme Court's decision to remove rights from women by striking down Roe v. Wade, the number of abortions in California has increased by 20%, mostly from out-of-state people seeking the care that they're denied at home. Now, I want to point out to you, if this is a subject of, if women's health is a subject of interest to you, and it ought to be, go to the newsletter, because there is an article called Women's Health in Your State, and there is a link to the Kaiser Family Foundation website, to one of their pages, that there's a map of the U.S., and you just click on a state or type in the name of the state, and it will provide for you tons of data about available women's health and what it's like in that state. Abortion data, maternal and infant health data. They'll have demographics, including race, ethnicity, poverty level, health insurance coverage, ACA Medicaid expansion, Medicaid eligibility levels, access and utilization, rates of cancer screenings, health status, the rates of breast cancer and cervical cancer by race, ethnicity, physical and mental health status. It's actually a really good web page. Okay, so I would recommend that to you if that's in your interest area. Let's talk about more reproductive health care lies. This one, I actually personally have high blood pressure when I get upset, and this one just shot it through the roof for me. So this is more healthcare lies about reproductive health care. Anti-women politicians spread an awful lot of lies. Here's one: life begins at conception. No, it doesn't. Pregnancy begins when a fertilized egg attaches in the uterus. That's the definition of pregnancy. Now, I mention this because right-wing Republican theocrats, including the Speaker of the House, are running around claiming that life begins at conception. The reason for their spreading this falsehood is that there's an active movement afoot to declare contraception illegal. Morning after contraception works by preventing the attachment. And that's just the start. You know, IUDs are next, and then good luck trying to get a condom. Striking down the right to abortion sent women's rights to privacy straight to hell. Now, the strategy used there can be repeated for contraception, the strategy used to strike down the right for abortion. And it is the right of privacy. Now, let me give you a little bit of history on that. In 1965, the Supreme Court ruled in Griswold versus Connecticut that the Constitution protects the right of marital privacy against state restrictions on contraception. The case involved Estelle Griswold, she was the head of Planned Parenthood in Connecticut, and C. Lee Buxton, a gynecologist at the Yale School of Medicine. They opened a birth control clinic in New Haven in violation of an 1879 Connecticut law that banned the use of contraception. The 1965 decision established a constitutional right to privacy regarding reproductive decisions. This decision paved the way for the legalization of birth control for unmarried couples. The court's decision has also been cited in the following cases. Eisenstadt versus Baird, 1972. It extended Griswold's holding to unmarried couples. Roe versus Wade, 1973, cited in the concurring opinion by Associate Justice Potter Stewart. Obergefell versus Hodges. It's cited in a chain of cases that led to the Supreme Court legalizing same-sex marriage. You can see everything that's at risk here. Let's remind our members of Congress and our senators that they need to pass at least 3 bills to protect women. Their contact information is down below in the resources section, and here are the bills. H.R. 12, or Senate Bill 701, the Women's Health Protection Act. H.R. 767, or Senate Bill 4467, Protecting Access to Medication Abortion Act, which makes mifepristone available via telehealth and by mail. And H.R. 4121, or Senate Bill 1999, the Right to Contraception Act. You see where that's coming from. You can use RESISTBOT on your cell phone just by texting SIGN, S-I-G-N, PAVVGX. Let me repeat that. SIGN, S-I-G-N, space, PAVVGX to the number 50409. Here's the message you're going to send. I'm your constituent and I am so angry. I just learned that right-wing Republican theocrats are attempting to make contraception illegal. Justice Thomas said he would welcome the case. No comment. Anyway, the right to privacy is under attack and I need you to stand up and protect women. Support, co-sponsor, and be vocal about those 3 bills. Anyway, your constituents are depending on you. Thank you. That's what I've got for you today. Down below, you can like, share, subscribe. You can subscribe to the Healthcare Advocacy newsletter for free. Get this stuff delivered to your inbox every day. Send me comments. Send me subjects you'd like researched. You can do it here in YouTube, or you can send an email to me at healthcareadvocacy1@gmail.com. Thanks so much. Have a good day.